Hey guys, welcome to another episode of Vet Explained. I'm Arav and today I'll be teaching you necrosis. Necrosis is the local death of cells or tissues in a living body. This is very important. It must happen inside a living individual. It cannot occur inside a dead animal. So for example, I am living, of course. So if for example my hand has a finger that is dead, then that is known as necrosis. Another important thing that you must write in the definition is that it is characterized by loss of cellular details, architectural details, or both. This is very important. So your entire definition becomes local death of cells or tissues in a living individual or living body that is characterized by loss of cellular details, architectural details, or both. Another important term is somatic death. Somatic death is the death of the whole individual. For example, if an animal dies, that is somatic death. And changes that take place gradually in cells while they are dying are known as necrobiosis. So if a cell is dying, necrosis ho rahi hai wo cell ki, then the changes that occur inside are known as necrobiosis, which is also known as physiological death. The causes of necrosis are basically very strong irritants that will damage your tissues, which are, for example, poisons, which can be chemical, plant, animal, etc. And there can be disturbances in circulation. If your body part does not get enough blood, then that part will die for sure. So for example, when people go to cold places and get frostbite, that is generally due to loss of circulation to the extremities, which is, for example, passive hyperemia, ischemia. Ischemia is narrowing of blood vessels. So whenever we talk about any condition or disease in pathology, you must show the changes that are occurring in the cells or tissues. So macroscopic changes are the changes that you can see with your naked eyes, and microscopic changes are changes that are occurring inside the cell, which you have to have a microscope to see. So the macroscopic changes is basically the dead tissue can be distinguished from surroundings. So there is a line of demarcation between the dead and living tissue by change in color. For example, the dead tissue is usually pale and has cooked appearance. Secondly, the necrotic area is usually surrounded by a red zone of hyperemia. Hyperemia is increased blood flow, and of course, since there is more blood, there will be a red area around the dead tissue. It is soft and friable, and there may be abscess formation. Abscess formation will occur when there are bacteria that are present in that area. So by pus producing bacteria, there will be abscesses formed. Secondly, it is a microscopic changes. In microscopic changes, there are two types of changes. The first one is nuclear changes, and the second one is cytoplasmic changes. Under nuclear changes, your first one is pycnosis. Pycnosis is the shrinkage of nucleus. The nucleus becomes small, and nucleoli are not visible. And since it becomes small, of course, it will become denser. Everything is coming together, so it will also stain darker. The second thing is karyarexis. So rexis generally means fragmentation or scattering or fragmentation of the nucleus. So karyo means the nucleus, rexis means fragmentation. Okay. The third one is karyoschisis. Schissis means the appearance of cracks in the nucleus. Karyolysis is, lysis means breakdown or dissolution. So karyolysis is the dissolution of the nucleus. And the last one is chromatolysis. It is the disappearance of chromatin in the nucleus. Under cytoplasmic changes, there are only two main things. The cytoplasm becomes swollen, and mainly it stains darker pink. That's all. Then coming to the types of necrosis, there are four main types of necrosis. The first one is coagulative necrosis, second is caseative necrosis, third is liquefactive necrosis, and the fourth one is fat necrosis. So the first one, coagulative necrosis. In all four types of the necrosis, there are different details that are lost. For example, in the first one, in coagulative, there are architectural details are not lost, but the cellular details are lost. So every single type of necrosis, you have to write the entire definition of necrosis, and then you have to write down which of the details are lost and not lost. So for example, coagulative, you will write local death of living individual characterized by loss of cellular details and not architectural details. And mainly, more than the macroscopic, in these microscopic changes are more important. So for example, the cytoplasm has no structure and architectural outline is maintained, but cellular details are lost. This is the main important thing. Your second type of necrosis is caseous necrosis. So under caseous necrosis, again you will write it is local death of tissues within living individual characterized by both architectural and cellular details, both are lost. And they are lost and then it is fused into a homogeneous granular mass. So it is a granular mass, kind of a ball that forms inside. And caseous means cheesy. So its appearance will be dry and cheese-like and granular. And of course, cheese, what color is cheese? Yes, white or yellow. So it will be around whitish or yellowish in color. And under microscopic, it is the same that all the details are lost, which is architectural and cellular. Now coming to the third type of necrosis. This is your liquefactive necrosis, which is also known as coagulative necrosis. So again, it is the local death of tissue inside living individual. It is characterized by disintegration of necrotic mass material into a liquid mass. So basically liquefactive, so it becomes liquefied. The necrotic masses become liquefied. And of course, since everything is getting liquefied, na cells bachenge, na architecture bachega. So loss of cellular and architectural details. Secondly, the liquefaction may occur by two ways. The first way is by action of intracellular enzymes. Intracellular enzymes are autolytic enzymes which are released by lysozymes, and it causes the disintegration into liquid mass. Your second type is by proteolytic enzymes, which is produced by leukocytes specifically. When are leukocytes seen? During an infection. So this, by proteolytic enzymes, the liquefaction will occur in infective conditions. And also I forgot to mention in the above caseative necrosis, the caseous mass, many a times it becomes, calcified, and there are calcium salts that are deposited onto there. So when you take it for examination and you cut it, there is a gritty sound when you cut it, like cutting sand. Then under this macroscopic, liquefied material is watery. So there's a lot of water that forms inside. And if there is water, of course, there will be a space or a cavity present inside. So many a times there is a cavity that is left behind, and in long-standing cases, fibrous capsule is formed around that cavity. And generally, the fluid gets absorbed back into the body. So if your body keeps keeping the fluid around, then you will be full of cavities in your body. So your body generally absorbs the fluid. And microscopically, a cyst-like space. Basically a similar concept. A cyst-like space is finally visible because the fluid is absorbed back. There is an empty area inside. And the final type of necrosis for you is fat necrosis. So fat necrosis is the death of adipose tissue or fat tissue inside the living individual. So there are three types of fat necrosis. The first one is traumatic. The second one is pancreatic or enzymatic. And your third one is nutritional. So for the first one, traumatic. By trauma, you mean injury. So if there's any kind of injury to the fat tissue or fat cells, then it will cause the necrosis of those fat tissues. Secondly, pancreatic or enzymatic. If by any chance there is damage to the pancreas or necrosis of the pancreas, the lipase enzymes from the pancreatic juice may leak out of the pancreas and go into your abdominal cavity. So abdominal cavity has fat. So that fat gets broken down by the enzymes. And the third one is your nutritional fat necrosis, where if in case of starvation or emaciation in debilitated individuals, it causes necrosis of the fat. So that's all for necrosis, and I hope you guys understood something from this. And for more details and more information, these notes will be linked down in a comment or a link down below. So please refer to that. Thank you.